Hi everyone, Dr. Samina here, and today I'm going over my lab reports. This is postpartum PCOS, so I am now almost 15 months postpartum with my baby, and so I decided to get some lab work done, and so I wanted to go over it with you to show you how I would go over lab work with the patient, looking at my view on what I would be looking at in terms of different labs. So the first thing is a CBC. This is complete blood count. We're looking at your red blood cells and your white blood cells here. So for me, biggest thing I'm looking at here is what does the hemoglobin look like? This will give us an idea of iron status. So at 140, it looks really good in my report here, in the middle range here between 120 and 160. I also just want to say that all these ranges are for Canadian units, so if you're in another part of the world, you might want to just look up units that make sense in your lab work. Okay, so ferritin, this is the storage form of iron. So we're looking at iron over 3 months. At 124, it's actually really good number. So I'm taking a prenatal that has iron in it because I'm breastfeeding. So this is probably why this number is high. And also I eat lots of protein for breakfast, lunch, and dinner. Okay, so the next thing is the glucose section. So fasting glucose is at 4.3. Typically, I want to see this at 5.3 or less than that. So quite a low number here, which is good. Actually, we don't want fasting glucose to be high. I fasted about 15 hours for this test. I was really hungry when I got it done, so it makes sense here because my blood sugar was a little low. And also hemoglobin A1C. This is a long-term view of glucose. Basically, it's glucose bound to hemoglobin in the red blood cell, and we know the red blood cell lives for about 4 months, so this is giving us a long-term view of glucose. It's also a test to screen for diabetes, so typically I don't want to see this number passing 5.3, so at 4.7 I'm looking really good. Okay, so let's keep going here. This is the cholesterol panel. There's 3 big things that I'm looking at in cholesterol panel. The first thing is the triglycerides. These are a type of fat that accumulate in the liver. Typically, I don't want to see triglycerides passing 1.5. So at 0.34, that's very low. So meaning that anything higher than 1.5, I'm starting to consider non-alcoholic fatty liver disease, which is typically due to insulin resistance. The second thing I'm looking at is HDL. This is good cholesterol. Typically, I want good cholesterol to be greater than 1.3. So my good cholesterol here is really good. I eat lots of healthy fat. And I actually haven't been taking my fish oil regularly. So I'm actually surprised that this number is really good. But I eat lots of healthy fat. So that could be the reason why. LDL cholesterol, typically you want to see this number at 2 or less than that. At 1.78, my number looks really good here. So again, LDL, bad cholesterol, typically you want to see this at less than 2. So fasting insulin, this is a marker to look for insulin resistance. Typically I would want to do an insulin glucose challenge test. This looks at insulin over a 2-hour period, but I just did a fasting insulin here and my number is quite low. At 20 here. See the reference range between 20 and 180. So it's very unlikely that I have insulin resistance. But challenging it with an insulin glucose challenge test would give us a better idea here. But just a screening test here for fasting insulin, looking like my fasting insulin is really good. And honestly, based on these numbers, I would be a candidate to be eating some carbohydrates in the morning. Whereas if somebody has insulin resistance, maybe we'd be changing that up a little bit depending on how bad the fasting insulin is. So TSH, this is thyroid stimulating hormone. Basically, it tells the thyroid to release T4 hormone. This is one of the thyroid hormones that gets converted into T4 gets converted into T3. So let me back that up and say this again. Thyroid stimulating hormone comes from the pituitary gland in the brain. It tells the thyroid to release T4 hormone. T4 hormone gets converted into T3. This is our activated form of the thyroid hormone. So we want a good amount of T4 and T3. This tells the brain, the pituitary gland, to not produce too much TSH. So that's what we're seeing here at 0.94, that my TSH is pretty low, meaning my T4 and T3 are probably at a good range. But it would obviously be better to test them. We just didn't get to test them on this lab. So now we're looking at FSH and LH. FSH is follicle stimulating hormone. It tells the ovaries to produce estrogen. LH tells the ovaries to produce testosterone. So this was done on cycle day 5 for me. Typically, you want these numbers to be around the same number. In PCOS, we can see this LH to be quite high for some women because it can be a marker that testosterone is high. So sometimes we'll see FSH, say FSH is 6, then we might see LH at around 18 or even 24, about 2 or 3, 4 times higher than the FSH. So my numbers are looking really good here. Typically, we do want to see FSH a little bit higher than LH, and we want them to be at a close number here. So 6 and 4 are pretty close together. I'm exclusively breastfeeding right now, so my prolactin levels typically would be high in breastfeeding. So even though they're not higher than the reference range, they're still high normal. We typically don't want prolactin to be greater than 20. So if you're not breastfeeding and prolactin is higher than that, around that higher than 20 mark, then it would be good to take a look at prolactin again to see if it stays high, because sometimes stress can also trigger prolactin levels to be higher. Estradiol, this is estrogen. So on cycle day 5, my number is quite low, less than 40. Typically, you want to see it at around 80 to 180 or even higher on cycle day 5. But when you're breastfeeding, estrogen levels are low, prolactin is high, so that could be what's going on here. But I'm still ovulating because I did test my cycle day or 7 days after ovulation, estrogen and progesterone, and I am ovulating. It's not in this report, it's in another one, so maybe I can do another video on that as well. Progesterone levels at this time need to be low, so that's what we're seeing here, so that's great. And then some markers for testosterone. DHEAS, or waiting on androstenedione, this is another marker. But DHEAS is a type of testosterone that comes from the adrenal glands. It eventually becomes testosterone, so it can cause symptoms of acne, hair loss, excessive hair growth with that testosterone. But basically, if it's DHEAS is high, this is telling us that maybe cortisol is high and it's driving this number up. My history has been that my DHEAS has been higher in the past. So at an 8.6, this is high normal, I would say. It's a little bit too high, which makes sense. I'm in the postpartum period and there is quite a lot of stress, I'm not going to lie. So that's something that I'm noticing here that I need to still work on. So that's going to be my next plan of action. In terms of total testosterone, 0.8 looks pretty normal to me. It's also based on age because our testosterone declines as we age. So this looks normal to me as well. And then my free testosterone at 13 looks really good. Then vitamin D, this is one that I really wanted to know. Vitamin D is extremely, extremely important and really important, especially to be taking in the summer. For somebody who's like me, who has darker skin, I'm not absorbing vitamin D as someone who would have lighter skin. So I have been religiously taking this every day, every week, not forgetting this, because first time I ever tested my vitamin D was at 7. And my doctor was shocked. I don't think she'd ever seen a low number like that before. So I always make sure that I'm really religious with vitamin D. So at 143, a really good number. I typically like to see this greater than 100. So I'm doing really well in terms of this. So I hope this was able to give you an idea. There's some other tests that I would have run, like HSCRP. Maybe I would have run 17-hydroxyprogesterone, liver enzyme is ALT, AST, DHT, this is dihydrotestosterone. This is a more potent form of testosterone. Testosterone becomes DHT. And just thinking if there's anything else. Oh, and kidney function test, just to make sure my kidney is functioning well. But it's always been functioning well in the past, so I decided not to test that in this blood work. Another one for me is CA125. That's on my list to do next, to test, because there was a little bit of a history of endometriosis in my case as well. So something that I'm going to be looking forward to testing very soon, and AMH, anti-Mullerian hormone, because this can be high in women with PCOS. So I really hope this was able to give you an idea of what lab work should look like in a woman with PCOS postpartum. If you have any questions at all about lab work, please let me know. I would be happy to answer them. Okay, have a good night.